Hi everyone, my name is Anna Laucis and I'm a Chief Resident Physician at the University of Michigan and happy to present this work on TwitterKit and would like to acknowledge all of my co-authors for their wonderful contributions. So as a bit of background, we all know that social media use is really common, but some of the etiquette surrounding professionalism can be quite fuzzy. For example, is it really okay to reply to a well-known attending with a meme? They might really like it, or it might be really bad. And some of these cues can be a lot more difficult to pick up on the digital platforms versus in person, where we have all the benefits of nonverbal cues. So the purpose of this talk is really to start exploring some of these themes regarding Twitter professionalism and etiquette in our field of radiation oncology, and hopefully continue the conversation with you at ROECSG and in the future. So our methods involved reviewing the literature from 2015 to 2020. We did not find any specific articles on this niche area of Twitter professionalism and radiation oncology, but we did find a number of articles relevant to this area regarding social media use in general, and we'd like to highlight a few of those for you, starting with this Advances in Radiation Oncology article from 2017, which showed a few important points, one of which is that social media use is not just common, but really is growing at almost an exponential rate, as we can see by this graph here, just the astounding interest in tweeting during meetings, including ASCO, over 70,000 tweets per day at the 2016 annual meeting. I expect that number would only go up over time. And this is true even of smaller meetings like ASTRO, where we can see, just 6 tweets per day on day 2 of the annual meeting in 2014, all the way up to over 1,600 tweets per day in 2016. And I, again, would expect this number would just continue to rise. And so a really great framework in terms of thinking about professionalism issues in social media use was laid out in this article. So the 4 R's, reflective, responsive, relevant, and rigorous. And I think these are just great words and kind of a great framework to think about our interactions on social media platforms such as Twitter. Switching gears a bit, Forbes published an article about a year ago on how social media use can advance cancer research. And this was by Dr. Miriam Knoll, who's a radiation oncologist and an active advocate on Twitter as well. So some of the pearls of knowledge from this great article: social media can offer a platform for connecting researchers and scientists and medical professionals with the lay public and patients who could potentially enroll in their clinical trials. And this could encourage more participation, both through direct relationships with patients, but also reaching out to colleagues at other institutions. And to help facilitate this further, there are certain online communities using specific hashtags for which you can do weekly Twitter chats to engage the public as well as colleagues. Some of the specific, disease-specific hashtags include sort of all of the following, as well as hashtags like RadOnc and Women Who Curie. Astro actually has a social media best practices guide that's published online with a lot of common sense ideas, but one at the end just wanted to highlight really respecting the platform and following unofficial rules. Really, what are some of those unofficial rules? And so this is just a summary slide here, kind of a rapid fire sort of review of this topic, but some of the do's, those 4 R's that we were talking about: engaging in real time, educating patients and colleagues, using official hashtags when possible, don't be disrespectful, break confidentiality, or hide conflicts of interest, and just remember that your comments are considered in a certain context. And I would also like to highlight this wonderful webinar by Dr. Chino. It can expand on this topic a lot more. Would like to thank everyone, and here's my references.